Hi, good afternoon. Today we're going to be doing an assessment on the gastrointestinal where I will be focusing mainly on the abdomen. Um, what I am going to do is give my client as much privacy as possible. I will not expose the chest or any unnecessary areas. So I'm going to keep him covered, only expose what is necessary at that time in our assessment. But right now, today we'll focus mainly on the abdomen. What I'm going to start off with is inspection of the abdomen. I'm going to look for, is there any abdominal distension? Is there any jaundice going on? Is there any bowel waves that I can see? Any scars, any masses, any lesions going on? So far I don't see anything. So that's a good start. Next, I am going to listen to the abdomen, and I'm going to auscultate each quadrant for bowel sounds. Excuse me. The abdomen can be broken down into 4 quadrants as well as 9 quadrants. You'll zoom in with me. We will break down right down the center, and again at the umbilicus, right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. This can further be broken up again, straight down, 2 lines this way, 2 lines this way. I will have my right hypochondriac, my epigastric, left hypochondriac, left lumbar, umbilicus, right lumbar, right iliac, suprapubic area, left iliac area. Are you able to see me? Yes? Okay. Next, I am going to be auscultating for bowel sounds. Now, when we're listening for bowel sounds, we're going to be listening with the diaphragm of the stethoscope. We will listen for 3 to 5 minutes in each quadrant. We're supposed to hear normal sounds or like the gurgling sound. No bowel sounds. Bless you. No bowel sounds is something we should be worried about if we do not hear anything. So with the diaphragm of the stethoscope, I'm going to listen, again, 3 to 5 minutes, but I will speed this up for the video. Now while I'm auscultating, I can also switch to the bell, and in our right upper quadrant, I can listen for any hepatic frictions going on or any rubs. Then I can move right above the umbilicus to the aorta, listening for any bruise, any swishing sound. I can move to my left upper quadrant, listen for any splenic friction rubs going on. I do not hear anything. That is a good sign. After auscultating, next would be percussing. This is when I will break the abdomen into the 9 regions, and I will be checking for any dull sounds going on. Alright, I percussed, I didn't hear anything. Now, that normal sound would be a big thud or a dull marking that would be indicative of some type of mass, something going on in the quadrants. My next step, after I have inspected, auscultate, and I have percussed, I am going to palpate. I'm going to break it back down into 4 regions, and I'm going to start with the right upper quadrant. I am going to check for the border of the liver. I am going to do a hook technique. We'll find the margin of the rib margin, and I will hook to see if I can locate the border of the liver. There we go. Now there is also a test I can do while I'm here, and this will be checking for any gallbladder inflammation. I am going to press down, and I am going to ask him to breathe in. Take a deep breath. Okay, you. Oh, excuse me. All right. Sorry about that. Can you take a deep breath for me, sir? While I press down. Okay, again, deep breath. All right. Now, if he wasn't able to take that deep breath while I was pressing down and he was in pain, I'm going to make sure I keep an eye out on his face while I'm pressing down. That would be a positive Murphy sign showing some type of inflammation that is going on in the gallbladder or cholecystitis. Next, I will check the left upper quadrant. Now, I shouldn't be able to palpate the spleen. The spleen is located in the back. But what I am going to do is to check to see if there's inflammation. I'm going to locate the rib, the 12th rib, move up to the 10th intercostal space. I am going to ask him to take a deep breath. Now, if I was able to feel a bulge come through and the spleen is inflamed, then we know that's an abnormal sign. If I don't feel anything, that's okay. It just means that the spleen is where it should be, and so far nothing's going on without diving deeper in. Next, I would be checking the right lower quadrant, and in the right lower quadrant, I can do a test. I'm going to look for McBurney's point. First, I'm going to locate the anterior iliac spine, then the umbilicus, and go 2/3 down, and this is McBurney's point. I'm going to perform a rebound test here to see if there's any appendicitis. I'm going to press down and let go quickly, and if there was any pain, I'm going to look at his face while I do this test. If there was any pain, any signs of guarding, that would be a positive sign for appendicitis. I can do the same test on the left lower quadrant. It's the rebound test, and this test is called the Rothsing's test. And I will do the same rebound and pay attention to his face and abdomen. See if there is any, if I press down here and the pain were to show up in the right lower quadrant at McBurney's point, that would be a positive sign for appendicitis or some type of peritonitis going on in the lower abdomen areas. That would conclude my test of the abdomen, and I thank you for watching. Bye.